Welcome everybody. Fantastic to have you here on our fourth of 6 webinars from the Driving Health team from Monash University. So we are delighted to bring to you today the next in our series of 6. So this is a 3-year study and we're into the final year of our 3-year study, and it's great that you are here interested in the information and the data that we're wanting to give out there. Now there's a huge amount of data and information, so we're doing them in little snapshots so that you can get a little taster of what some of the results are. All of our information is on the website, drivinghealth.net, complete with 60 or 50 page reports and 1-pager summaries as well. So feel free to go there and find the information in more depth, and also the recording and replay of these webinars. So welcome to those who are watching live and those who are watching the replay as well. Fantastic to have you here. Right, so I'm Dr. Elizabeth Pritchard from the Driving Health team, and I'm going to introduce you today to the person who is going to be taking us through muscles, joints and driving. So I have Associate Professor Ross Isles, who's the Deputy Director of the Insurance Work and Health Group, and also overseeing the whole Driving Health project and team. So I will hand over to you, Ross. Thank you for being here, and let's have a wonderful afternoon finding out about muscles, joints and driving.
Thanks very much, Elizabeth. I will share my screen so everyone can see the slides. Hopefully everyone can see that okay. So thanks very much, Elizabeth. As Elizabeth mentioned, the Driving Health study is a 3-year study, and today we're talking about muscles, joints and driving. So if you like, maybe you'll refer to that as musculoskeletal conditions. We just thought it's a better way to put it. So I will make sure I can work the technology on my end. So I forgot to say, if you've got questions on the way through, pop them in the chat box or the Q&A slot, and we have time at the end where Ross is going to be answering questions. Thank you. Thanks, Elizabeth. If this is the first of our webinars that you've joined in, this will be new information. So I'll go through it quite quickly for those who've been to our webinars previously. But Driving Health is a 3-year research partnership with our research partners Linfox, the New South Wales Centre for Work Health and Safety and the Transport Workers Union. And we also have the support of the National Health and Medical Research Council Partnership Project Scheme. Now, to our knowledge, it's the largest Australian-based study that's focused on the health and well-being of truck drivers. And while there is a large body of research coming from North America and Europe, we believe it is critical to have evidence that represents Australian drivers working under Australian conditions. Now, the Driving Health study has examined multiple sources of data to inform our findings. Some of this comes from existing sources. So, for example, more than 120,000 accepted claims for workers' compensation. Excuse me for a moment. I've just got a...
All good. Working from home. This is what happens. All good. Fantastic. Sorry, I just muted you just then, Ross, so you'll need to unmute.
Thank you, Elizabeth. I could not find the mute button.
Oh, good.
Sorry, it is working from home, so apologies for that. Not apologies for my children, they're wonderful. We're using existing data sources, so from accepted workers' compensation claims. Some of it involves using data for the first time. So some information comes from death benefit claims from the largest industry superannuation fund. And we've also generated new data directly from over 1,400 drivers, both in the form of an online survey, follow-up telephone surveys and in-depth interviews. And so all of the results that we're showing you are drawn from the different parts of the Driving Health study. So we think that gives us the clearest picture to date of the health and wellbeing of Australian truck drivers. So from our analysis of workers' compensation claims over a 12-year period, the most common type of injury drivers made a workers' compensation claim for was a musculoskeletal injury. So as the label suggests, musculoskeletal injury is an injury either to a muscle or a bone or a joint in the body. So when we say musculoskeletal injury, we're talking about torn muscles, injured joints, and it can even be broken bones. And it can cover any part of the body. So we're talking shoulders and knees, and it includes common conditions like back pain or neck pain. So the data showed us that, truck drivers are at a greater risk of fractures or broken bones than other workers. And, perhaps that's not particularly surprising when drivers are more likely to be involved in a crash because of the amount of time they spend on the roads. But what we found was that only a small proportion of the workers' compensation claims were actually the results of a crash, and that 83% of the burden of injury and illness in the workers' compensation system was due to musculoskeletal and psychological stress. And that's true across all ages of drivers, all sizes of employers, and body stressing was the most common mechanism of injury. When we looked into the detail about musculoskeletal injuries, the median time taken off work for a musculoskeletal injury was just over 5 weeks, so 5.2. You can see on the slide there, it's been circled. So that means that around 36,000 drivers needed at least 5 weeks off work due to their musculoskeletal injury. And that's a hell of a lot of time off the road. So what are drivers doing at work that puts them at greater risk of musculoskeletal injury? In our telephone interviews with just over 330 drivers, we asked them how often they had to perform tasks that are known to put people at a higher risk of injury. So this slide shows a snapshot of the questions asked, and I've focused on the most commonly described musculoskeletal risks. So in this case, doing repetitive movements or manually lifting or pushing heavy items. So on this graph, you can see the parts in blue represent drivers who said they had to do the task at least monthly, and the darker the blue, the more frequent the task, up to having to do it daily or pretty much almost daily. So when it comes to repetitive movements, if you count up all the blue, around 70% of drivers are at least monthly doing these repetitive movements. If we focus on the darkest blue, it means more than half of drivers are doing it daily or almost daily. When it comes to moving those heavy items, more than 40% or 2 in every 5 drivers are doing it daily. And that adds up to a really high risk of injury, especially if you've not had a chance to prepare your body for strenuous activity. So if you've been sitting stationary for a large period of time and then you have to do this strenuous activity rather than actually having time to prepare yourself for it. So these are 2 examples of the injury risks we asked about at work for drivers. Everything's happening today. The dogs are barking in the background too. It's perfect. Great, we're recording. When we counted up all the risks, we divided them up into 3 categories. And with less than a third of the drivers actually sat in the low risk category. So when we counted up the risks they do at work, only about a third had low work-related risks. But it's worth noting here that the tool used to measure these workplace risks really only had a low and a high risk classification. So everyone above low risk would just be called high risk. But we found that our drivers have so many risks in their workplace that we needed to add the moderate category to give us an idea to separate, well, who's actually experiencing a large number of work-related risks for musculoskeletal injury at work. And as you can see on the numbers there, that 22.3% of drivers are actually in our high risk category, which didn't even exist before. So what that means is that at work, the tasks that drivers are forced to do, they're actually putting themselves they're at a very high risk of sustaining a musculoskeletal injury. And that makes sense, if you like, when we see that they're at a greater risk of musculoskeletal injury than all other workers in our previous analyses. So where do these work-related risks mean we land? Well, the most common pain location reported was back pain, and that was followed by shoulders, necks, and knees. To quote a driver from our interviews, this is the direct words of the driver themselves. So it has always been niggly at the back there. I can lift heavy things, I can maneuver heavy things, and then all of a sudden, like the other week, I was teaching a guy to drive a truck, sitting in the passenger seat for about 4 hours. I could hardly walk the next day. It's just because there's no suspension in the passenger seats in trucks. So here the person's describing that they've always had a few back problems and they'd still be able to do what they needed to do, But if you change things up a little bit, like actually doing some training, you put them in a different environment to what their body's used to, in this case, the passenger seat rather than the driver's seat, and it actually means they're actually experiencing a significant flare-up of the condition that they're usually able to manage. So the numbers in this graph are the number of our telephone survey respondents reporting pain in each region. What you can see here is there are many more regions on here than there were drivers interviewed. So that means many drivers are actually dealing with multiple pain sites. So it could be back pain and neck pain, or it could be a problem with their shoulder as well as their back. And one thing that we know also is that drivers put up with pain long-term. So from our online survey, nearly 1,400 drivers, 3 out of every 5 drivers reported pain, and more than 70% of those drivers said that it lasted longer than 3 months, which is the common definition of chronic pain. So if our drivers have pain, they have chronic pain most of the time. And from what we can see in this slide, they've got that pain in multiple places. So what can we do? Oh, here's another quote from one of our interviews. And I love this quote. Full disclosure, I'm a physiotherapist. So anyone who's talking about exercise being a good thing, I'm going to think that's great. So here's the quote. Drivers have got to realise that the body needs to move. You've got 2 aspects. You've got fatigue and then you've got chronic disease. Both can be fixed with a bit of exercise. They talk about putting gyms in truck stops. Well, that's just creating a testosterone competition. Personally, I'll put the kettle on. I'll walk around the truck 3 or 4 times. And what I like about that claim, about that quote, is that it talks about the driver themselves recognising the importance of exercise and musculoskeletal conditions, not only for being able to move and get your body moving, but also the long-term benefits, and then adjusting exercise to suit them. And I can tell you from a physiotherapist perspective that the most effective exercise is always the one that you actually do. So when it comes to exercise, and you can see here, drivers just about passed. You can see the average amount of exercise and vigorous intensity exercise performed by drivers. The average here of 223.7 minutes of moderate exercise is slightly above the recommended dosage of exercise, which is 220 minutes per week. When we look at that summary variable down there, 48.5% of drivers actually met the daily recommended levels of exercise. So clearly there's room for improvement in terms of helping our drivers to get more exercise and help with those musculoskeletal conditions. But it's not that easy. So as this driver said, if you drive for 4 or 5 hours and then you stop for 15 minutes, the last thing you want to do is get out and do some push-ups. And I know I can certainly relate to that when I've had a tough day. The last thing I want to do is drop and give you 20. But what we did find is that there are other things that can help too when it comes to physical health and musculoskeletal health. And that includes occupational health and safety training. So when it came to OHS training, we found that higher levels of training actually had a protective effect. That is, that better training was associated with higher self-rated workability and lower levels of psychological distress. And what we can see from this graph is that around 2/3 of drivers had received training that would likely help them to manage the occupational health and safety risks. So that's good news. And we need to continue efforts to provide these types of training to drivers. So things are just general training around regulations and practices, but then also particularly manual handling practices. And we saw earlier in the presentation how often drivers are putting up with, I guess, manual handling tasks, repetitive movements and shifting heavy weights. So we need to continue that training to help them so they can actually do those in the most effective ways without putting themselves at risk. Finally, we need to encourage drivers to seek help, as health professionals can help drivers deal with the challenges they face on the road, as described by this driver, another direct quote. I have got some injuries, but that's musculoskeletal. I've got that checked out. Now that can be dealt with by my chiropractor or remedial massage. I do exercises, so those exercises keep me tuned up. And if I do hurt my back, been shown how to fix it when I'm away. So I pretty well tune myself up these days. So encouraging drivers to seek professional help, well, it can actually give them the strategies to be able to self-manage when they're on the road, to deal with their conditions, and actually not only deal with the conditions, but prevent them through generalized strengthening programs. And when it comes to musculoskeletal conditions, the single best piece of evidence supports that exercise is the best approach, both from a prevention perspective, but also then a treatment perspective. So many people think, well, it's just up to the driver to be healthy and stay healthy. But we know from our 2 years of research that the solutions are complex and they require a multi-pronged approach. It's not just about the driver, it's also about the industry, the regulations, and the way each company works with and supports drivers as well. We have developed a short 20-minute online training program that's coming up in October for allocators, line managers, or supervisors, or whatever those people who work with drivers might be called in your particular aspect of the transport industry, to identify what areas they can have influence over in relation to helping to support driver health. We'd love to offer you this free training, and with it comes a list of resources to help make your job easier in relation to how you could help support the driver to be healthy and stay healthy at work. Please click on the link and sign up now to receive this training program online in October for you or your workmates to complete. And now I'm happy to answer any questions anyone might have about musculoskeletal conditions or any other aspect of the driving health study.
Fantastic. Thank you, Ross. Yes, we do have a question. I've just lost it. It's gone.
Everything's happening in this recording.
Oh my gosh,
it's dogs. It's great.
I was responding to the person and now it's disappeared on me. Okay, it was around what is causing, from our research, do we know what's causing the musculoskeletal injury?
The nature of the research that we've done, we went out and we've used different data sources. So for the workers' compensation data, we know the person actually has an injury and we can find out what type of injury that they had, whether it's musculoskeletal or whether it was something else. But that data doesn't tell you why that person was injured or how. We do, when we surveyed drivers, we surveyed them regardless of whether they had an injury or not. So we didn't have the time to be able to ask them, do you tell us how that injury happened? And probably if you've ever been to a physio or a doctor and you say, well, how have you hurt yourself? It's quite a long story for the first injury and then the second injury and then the third injury. If there's multiple injuries, it can be quite difficult. So where we try and get the best information that we can is from asking people about, well, what are the sort of tasks that you need to do at work? And that's where we ask that occupational risk factor question. So how often do you push heavy weights? How often do you need to do repetitive movements? And if you're doing that often, that's a likely source of injury. But we do know that drivers have sustained injuries from falling off the truck, getting in and out of the truck, for example. And I know there's a big focus on your 3 points of contact as you're entering and exiting the truck. Slips, trips and falls and being hit by objects or other mechanisms that are common. So we can't sort of put an absolute finger on, well, if we stop drivers doing one thing, that'll stop these musculoskeletal injuries. But the best thing we can do is prepare drivers the best they can to cope with that. And sometimes that's actually about, sometimes the drivers might actually need to say, no, I'm not going to try and move that. We need that particular piece of equipment, or, you know, we need the forklift to do that, or whatever it might be.
Cool. Okay, and an extension from that, from Simon, the load restraint performance standards muscle effort, has any analysis been done in this area?
Certainly not as part of the driving health study. We haven't been able to dive into that aspect. We would love to hear about any research that has been done in that area, and if we can help to, if that can help to fill out that picture of driver health, and particularly some of the preventative strategies. I certainly know that AusHelp, for example, are doing a lot of work in this space. So there are multiple efforts going on in terms of helping drivers to be healthy at work, and we'd welcome if we can add that research to what we've done. That would be great.
Awesome. And we've got a question from Kim saying, has there been any connections between unfit or unhealthy drivers having more injuries?
That's a good question. So with our with the analyses that we've done, where we've collected lots of information about drivers, and we've looked at the outcomes of general health and physical health, one of the biggest impacts on physical health, the outcome of physical health and the outcomes of pain, has actually been the presence of a number of multiple health conditions. So we know that drivers who had 3 or more ongoing health conditions were more likely to have poorer outcomes in terms of general health and in terms of pain. So I think in a broad way that answers that question in terms of drivers who have poorer general health or are dealing with multiple health conditions are more likely to experience pain, and they're more likely to be dealing with musculoskeletal conditions at work.
Awesome. Any ongoing other questions coming through? Just pop them in the chat box, and please be aware, as we said, that the intervention program is going live in October. If you want to be part of that, the sign up page is in the chat box again, and it's on our website as well, drivinghealth.net, and we would love you to be part of this program going forward. It's just a 20-minute online training program with a couple of questions before and after. And we actually did the filming today for it, which was great. We could do that today. And we would love you to be part of this because, as Ross said before, we're all part of this multi-pronged approach to look at how can we all support our drivers to be healthy and stay healthy at work. So do we have any additional questions coming through from anybody attending today? Yes, one from Ellie. Do you have any insight into managing or preventing muscle or joint injuries from a nutritional point of view?
Oh, from a nutritional point of view,
I can answer that a little bit from some of the in-depth interviews.
Yes, please. That would be great.
Okay, cool. So when I was doing the in-depth interviews with drivers and family members, they talked about how hard it was to access healthy foods on the road, that the truck stops, most of them were fast foods, and even though they cooked and took their own foods and frozen in the little fridges in the trucks, often that didn't see them through the whole week. And there was also different quarantines for fruit and veg going across state borders, etc. And so some of them were talking about they really aim to be healthy because they know it's better for their bodies, their joints, their pain levels, their stress levels, their sleep. And yet they had this massive sort of conundrum of, well, how can I when my food runs out after 4 days because I actually can't take enough in the fridge, or I can't actually take that over the border for my next job. And so the interaction was appearing to be like, when I eat really well, I have less aches and pains. However, we haven't tested that or haven't specifically looked at that. Okay.
In the absence of a question,
we've got another couple, but go for it.
Oh, I was going to say, in one of our previous webinars, we had lots of questions about the seat that drivers are in. I've got a quote here that feels like it's appropriate. This is a quote from the interview, so this is directly from a driver. He said, "The driver's seat is lovely. It's got so many ergonomic features on it, whereas the passenger seat has got nothing." So that really goes through your body. I've actually got a couch cushion that I use on the passenger seat. It might be 4 inches of foam, but it's enough to take out the jolting and the jarring of bouncing on the seat. So as far as the back goes, I know when I'm going to injure it, not to purposely go out and do it because it bloody hurts, but it's just it's good at the moment. It's good at the moment. It's okay. But then all of a sudden it's gone and it's too late. Really, having the appropriate seating and protecting the driver from the vibration is actually really, really important. We had a number of comments about that at a previous in our previous webinar, that it's very clear that we've taken steps to help the drivers with that, but we also then need to provide them with strategies so that it's not then all of a sudden it's just gone, and then it has a significant impact.
Awesome. Okay, so Kim has asked, is there any difference between local drivers compared to interstate drivers?
So in terms of outcomes, so we did look at our long haul compared to short haul drivers. What we did find was there were only minor differences in terms of the levels of pain and the types of conditions. I'm just stretching my memory banks for the exact information. But to be honest, when it comes to these outcomes of no, I do know. Apologies. So there was no difference in the intensity of pain that reported by long haul and short haul drivers, but long haul drivers were more likely to report pain that had lasted more than 12 months. So what that means is that I guess the pain patterns and the types of conditions that the drivers sustain or are dealing with are very similar. Long haul drivers, they reported dealing with pain on for much longer. But that was basically the only difference when it came to the types of conditions and the pain. I hope that answers the question. It took a little while for my brain to the right place. Apologies for that.
Awesome. And James asks, was there any consideration of a driver's adherence? Oops, oh, it's just popped off. Oops, lost it. Oh, sorry about this. No, it's going up and down. Was there any consideration of a driver's adherence to simple vehicle ergonomic principles and whether poor practices were correlated to injuries sustained?
That was one thing that we didn't actually measure through the gathering of the data that we did. So unfortunately, no, we couldn't. We're not able to say, or if someone was did you adhere to those practices or not? So the answer is unfortunately not. We couldn't give it consideration because we didn't have access to that data. One of the challenges for our study was to actually get the information directly from drivers, and so we had to keep things pretty brief because we know drivers are very busy. And so, as much as we would have liked to have asked everything under the sun. But what we can say is that there was at least high levels of training for some of those basic ergonomic principles, as indicated in some of the graphs that I showed earlier. And I'd say almost despite that, we still have high rates of injury.
Awesome. And we have a question from Sharon. Was there any indication of musculoskeletal injuries from steering or drive gear changing, not just the seat?
That's an excellent question, and I'm just scrolling up. I do have a quote that goes with that. So we didn't ask about that specific task, but here is a quote from a driver who said, "Yes, it is because anytime I grab the steering wheel, it's that bad that I can't turn the wheel with it. So it's really, really painful." It goes on to say that I remember about 12 years ago, I had a cortisone injection in there. And I remember him saying that because you can't whack another one in there after it's already damaged, he said too much tendon damage or something. So that's a direct reference to some of the tasks that they would need to do, and that actually while they're dealing with while the driver's dealing with in this case I believe it's back pain, that turning the steering wheel, it can be really, really difficult, and that turning the wheel with it is really, really painful. So that's as close as I can go to answer your question. And that was from an in-depth interview. So speaking with drivers at length about their health in the job.
Awesome. And Lance is talking about how the weight of drivers has increased, but yet the seats sometimes have a weight limit, and they haven't kept up with demand, so to speak.
And that was raised in our previous webinar, and that presents challenges. And the audience member let us know that there was a resulting workers' compensation claim, or an amount awarded afterwards because the driver was actually too big for the seat. So it actually has consequences not only for the driver themselves, but then also as businesses in terms of being able to demonstrate that they're looking after their workers and providing a safe workplace. So it is a challenge if drivers are getting bigger, that the equipment needs to keep up. I'd rather than the equipment keeping up, wouldn't it be fantastic if we were able to help drivers to be healthy and maintain what is a reasonably healthy weight for them. That requires long-term strategies and long-term support.
Absolutely. And just the final one, because I'm aware of time, Lance says, were the travel routes taken into consideration and road conditions?
We did ask about road conditions in terms of how often they drove on in difficult environments in terms of the road. In terms of the routes taken, no, we couldn't get to that level of detail. We just had indications of how far drivers would drive in a day and whether they would actually be home at night. So that helped us to identify whether they're short haul or long haul. And so our categories of short haul and long haul, not a huge amount of difference. And that the types of roads that they drove on, the amount that we measured it, didn't actually come up as significant in our analysis. Measure it comprehensively.
I know that in the interviews, people often mentioned it. It's like, I hate doing that trip because the roads are terrible and it's so much harder on me and I get stiffer. But as Ross said, we didn't specifically measure it in the telephone survey, but we heard narrative conversation around how that affected the drivers from their perspective. Okay, so that brings us to the end of number 4 webinar. We are back on Monday morning with Driving Through Pain. Ross is presenting that again. Thank you so much for attending this webinar. Thank you so much for your questions. And remember, please consider being part of the intervention program. I'll pop the link in the page. It's also on our website, drivinghealth.net, and go in under the DHAT program, which is the Driving Health Allocator Training Program. And we would love you to be part of that going forward, because we're wanting to approach this not just with the drivers, but as a multi-pronged industry. We need to look at interventions in different places. So thank you so much for being here.
Thank you.